repetition. At the very outset, I'd like to thank Dr. Sopon Samanta sir for giving me this opportunity to be a part of this session. Myself and Dr. Abhishek will be talking on LVA for high refractive error. I will skip all these initial slides because all these have been talked about. I will be covering about how we evaluate a patient of low vision with refractive error, and Dr. Abhishek will be dealing with the devices per se. So first, in the evaluation of low vision patients, we have to do a proper detailed history taking. Functional evaluation has to be done, and then the low vision trial and management has to be done. So when we talk about the history taking, it has to be the general information about something about the birth history and all, then how the ocular history, the systemic history, whether the patient has any comorbidities or anything, how the class in which the kid is going, the employment or the requirement of his job description, all these needs to be taken into account. Economic status also needs to be known about, and what are the task related history, these also we have to understand. So as in any examination, we first have to go for the visual acuity followed by refraction. The field testing has to be done. This will be followed by contrast sensitivity testing, color vision testing, and then an extra, which is not done for all other cases, is the glare testing. For visual acuity, we can stick to our Snellen vision chart, or logMAR is more recommended for distant vision, and for near vision, it can be a meter system. Refraction in low vision, we have to do objective and subjective refraction. As and when necessary, we have to do a dilated evaluation also. Radical retinoscopy and bracketing technique are something which is helpful for patient having low visions. Contrast sensitivity, the standard Pelly-Robson chart is followed, and we have to know about the functional capabilities of the patient. Color vision, we can follow the standard Ishihara, and this will help us to know about what is the career advice that we can give, because there are certain jobs which require patient to have no color vision blindness. Visual field can be done by confrontation, but perimetry will be preferred. Amsler's chart more relevant for macular disorder. Glare testing is done by a brightness acuity test, and it will let the person know that his assessment indoors and outdoors, how he fares with the glare testing. Now coming to the devices as such, already these have been talked about, so I'll skip them. One thing is important, that we have to do a calculation of the magnification, how much is the patient's distance and what is his working distance, and that will help us decide what will be the power that we want to give in the LVA. These are the various LVAs for distant vision and for near vision. Some of these have been talked about, of course. This is a Visolet, which is very helpful actually. It also works as a kind of a paperweight. It has an illumination and a magnification, and it can be placed on the table over the print, and it helps to a lot of extent. These are few of the non-optical devices which also has a role. This signature guide here helps persons really requiring those bank signatures and all. This is a useful device for patients having very high refractive error. And these are again some other devices which has also been talked about. Thank you very much for your kind attention.